Morning, everyone, and welcome to our October installment of Webinar Wednesdays with SMP. We appreciate you all joining us this morning to learn more about home health and hospice, red flags for fraud. My name is Sunny Lawless, and I am the Assistant Program Director and Volunteer Coordinator for our SMP programs. I'm going to be your host this morning. And presenting for us today are Keith Havens, our Media Outreach Specialist, and Danielle Guillory, who is our Mississippi Team Lead and Community Outreach Specialist. During the presentation, you can type any questions that you might have into the chat, but we are going to hold those until the end of today's presentation when we open things up for Q&A. We will also have a prize drawing for those who were registered to attend today's webinar. You had to have been registered by 10:15 a.m. this morning, and you do have to be present to win. Now, before we get started, I do have to let you know that this project is supported by the Administration for Community Living, Department of Health and Human Services as part of a financial assistance award with 100% of our funding by ACL and HHS. The contents are those of the authors and do not necessarily represent the official views of, nor are they an endorsement by ACL, HHS, or the U.S. government. If you never heard of an SMP presentation before, we do want to share some information about our program. Senior Medicare Patrols are grant-funded projects of the U.S. Department of Health and Human Services and the Administration for Community Living. Every state has its own SMP program. In Georgia, Louisiana, Mississippi, and Vermont, SMP is sponsored by AdviseWell. And our mission is to empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse. And we do that through outreach, counseling, and education. Now, before I turn things over to Keith and Danielle, we do have a quick polling question for you. The question is do you know the difference between home health and hospice care? So I'm going to go ahead and launch that poll. Do you know the differences between home health and hospice? And if you would, just go ahead and make your selection now, yes or no, and we'll leave the poll open for just a few minutes, a few moments, give everybody an opportunity to answer. Just a few more seconds. Everyone get those answers in, please. All right, it looks like 93. Let's see, I'm going to close it and share the results. There we go. So it looks like about 93% said yes and 7% said no. So I'm going to turn things over to Keith, who is going to get us started by looking at the differences between the two services. Keith?
All right, thank you, Sunny. There are several differences between home health and hospice care. Now, additionally, there are some similarities that make it difficult for people to tell the difference between the two. And today we're going to look at those differences to get a better understanding of these two types of care services and learn how to avoid becoming a victim of Medicare fraud. On the next slide, you can see a picture of home health, somebody getting a home health service. And first, we're going to be discussing what home health is. Home health is defined as a wide range of healthcare services that can be given in your home for an illness or an injury. Now, Medicare covers most home health services that are considered reasonable and necessary for the treatment of an illness or injury, usually after a hospital stay. The home health agency must be deemed Medicare certified. Home health agencies work with your doctor to evaluate your home health care needs and tell you what home care services you need. To be eligible for these services, Your doctor must certify that you are homebound and require at least one of the covered services. Home health is for individuals who are expected to recover from either the illness or injury for which they are being treated. Some of the services that are covered by Medicare are skilled nursing care on a part-time or intermittent basis. This care must be performed by a registered nurse or a licensed practical nurse. Also, physical therapy, speech therapy, and occupational therapy. Home health aid services on a part-time or intermittent basis to assist you with things such as bathing, using the bathroom or dressing. Now, Medicare will not pay for anyone to assist you with household chores such as vacuuming or washing clothes. Also, the covered are durable medical equipment such as walkers, wheelchairs, or bedside commodes. And certain medical supplies like wound care dressings that are ordered as part of your care are also covered. Okay, now let's start talking about hospice care and coverage. What is hospice care? Hospice is a special way of caring for people who are terminally ill. Hospice care involves a team-oriented approach that addresses the medical, physical, social, emotional, and spiritual needs of the patient. Hospice also provides support to the patient's family or caregiver. To qualify for hospice care, a hospice doctor or your personal doctor must certify that you are terminally ill, meaning you are not expected to live for more than 6 months, as well as being homebound. When you agree to hospice care, you are agreeing to comfort care, also known as palliative care, instead of care to cure your illness. You must also sign a statement choosing hospice care instead of other Medicare-covered treatments for your terminal illness and related conditions. Coverage for hospice care may include the following: all items and services needed for pain relief and symptom management, medical, nursing, and social services, medications for pain management, and durable medical equipment for pain relief and symptom management. Now, this may be things such as wheelchairs, electric hospital beds, bedside commodes, etc. With hospice care, you are acknowledging that you are not going to get better, and therefore the focus is on giving you the best quality of life possible given your condition. In this case, you may have an aide come in to assist you with bathing, going to the bathroom, and any other personal hygiene care that you need. Hospice care also allows you to have homemaker services. This is someone who will assist you with things such as light housework, changing your bed, and washing your clothes or dishes. This is one of the differences from home health. Now that you know more about home health and hospice care and coverage, we're going to talk about the different types of fraud that can occur with these services. The most common home health fraud scheme is when Medicare is billed for services such as physical, occupational, or speech therapy that were never actually provided. The beneficiary is asked to sign blank forms during a home visit. This allows the agency to then bill Medicare for a variety of services that were never provided. Unscrupulous physicians may also fraudulently certify that a beneficiary is homebound when they are not. Sometimes the beneficiary is offered cash or other incentives to sign these forms and allow the physician to charge Medicare for services that they did not perform. Another example of home health fraud is when Medicare is billed for skilled nursing care, but such care is not provided at all. Instead, the provider sends someone to the beneficiary's home to help with housekeeping and errands, but bills Medicare for skilled nursing services. Now, example of hospice fraud occurs when Medicare is falsely billed for services that are defined as hospice care. Example of hospice fraud includes a provider enrolling a patient in hospice care without the knowledge or permission of the patient or the family. A provider falsely certifying that the beneficiary is terminally ill. Now, what that means is the life expectancy is 6 months or less if the disease runs its normal course. Also, a provider billing for a higher level of care than needed or provided, or billing for services that were not provided. A provider keeping a beneficiary enrolled in hospice care for long periods of time without any medical justification. Providing inadequate or less care on weekends and disregarding a beneficiary's plan of care. Now, to avoid becoming a victim of home health and hospice fraud, keep these tips in mind. Never sign a blank form from your home health or hospice provider. Avoid offers for gifts or cash in exchange for your Medicare number. Watch your Medicare summary notice and explanation of benefits to make sure Medicare has not been billed for home health or hospice services that were not provided. And only agree to home health or hospice services if your doctor has certified you to receive those services. All right, now I'm going to turn things over to Danielle, and she will share the SMP 3 keys to success in preventing Medicare fraud.
Good morning, everyone. So the first key is prevent. Protecting your personal information is your best defense against healthcare fraud and abuse. You never want to share your Medicare number unless it is medically necessary, such as at your doctor's office or the pharmacy. And you only carry your Medicare card with you when you know you're going to use it. Remember, Medicare will never call you to ask for your Medicare number for any reason. And you want to keep this in mind to keep all records of your medical visits and procedures that take place and any medical equipment ordered. The second key is detect. That's knowing how to spot suspicious activity that can help you stop healthcare fraud and abuse in its tracks. Review your Medicare summary notices or your explanation of benefits. Your Medicare summary notice is mailed to you by Medicare every 3 months. If you have a Medicare Advantage plan, you're going to receive an explanation of benefits after any healthcare services. You want to compare your statements to your personal records and look for the following items: medical appointments you did not attend or that you were double billed for, and medical equipment such as braces, catheters, or diabetic supplies that you did not order or receive. And the third key is report. If you suspect you have been a target of fraud, report it. This will help you and others at risk for healthcare scams. Here are some of the steps to report suspicious behavior. If you receive a suspicious call, don't give out any personal information. Report the call to SMP immediately. If you have questions about your Medicare summary notice or your explanation of benefits, you can always call your healthcare provider or the plan. And if you aren't comfortable calling your provider or you aren't satisfied with their response, please call SMP at our 877 hotline number, which is currently being shown on your screen. You might be wondering how you can help and become involved. Senior Medicare Patrol is always looking for individuals to join our fight against Medicare fraud. Our volunteers receive training on the basics of Medicare and healthcare errors, fraud, abuse, and scams. In addition to giving presentations and attending community events, our volunteers participate, my brain is not working, in bi-monthly webinars and various training opportunities throughout the year. We also host a volunteer appreciation event in April for National Volunteer Week. Volunteering for the SMP program is extremely flexible and is done on an as-needed basis. They determine how often they would like to participate. If you think volunteering for SMP is something you might be interested in, give us a call at our toll-free number. That's 877-272-8720. We can send a volunteer information packet and answer any questions you might have about the process. Want to stay up to date on the latest scams impacting older adults in your community? Just scan the QR code using your camera on your cell phone to be guided to our social media platforms, including for Georgia, Louisiana, Mississippi, Vermont, and our Spanish Facebook pages. We also are on YouTube and have podcasts called Sip and Learn with SMP on Spotify and Apple Podcast. Our state-specific SMP Facebook pages are especially great resources for older adults and their care partners to find out about hot scams happening as soon as we learn about them from reports called into us or from our community partners. As mentioned in the previous slides, we have a toll-free number, 877-272-8720, that you can call to report potential healthcare fraud or to ask us questions about potential fraud, and even to request we attend your event or speak to your group on our fraud prevention message. The SMP cannot be successful in fighting Medicare fraud without reports from people like yourself, and we invites allowing us to reach older and disabled adults in your community. Additionally, you can visit our website, www.stopmedicarefraud.org. for more information about the SMP program in your state. Our website can be viewed in multiple languages by adjusting the language tab at the top part of your screen.
All right, thank you, Keith and Danielle, for that information on the SMP program and home health and hospice scams. Coming up next month for our webinar Wednesdays, we are going to cover scams. So our Don't Get in a Jam, Let's Talk Scams is scheduled for Thursday, November 19th at 10:30 Central, 11:30 Eastern. And we'll be talking about government imposter scams, identity theft, and other types of scams that affect older adults. So you can be on the lookout for an invitation to join us again next month. Now it's time for our prize drawing. So everyone who was registered to attend today's webinar prior to 10:15 a.m. this morning has been entered for a chance to win. The winner will receive a $25 Amazon e-gift card, and you must be present to win. So let me pull up our prize wheel. And as I said, you do have to be on the call to win. So let's go ahead, and we had a lot of registrations this month, so hopefully we'll be able to get us a winner pretty quick. Let's see, it looks like Samantha Brennan, and I am not seeing her name. So let's go ahead and give it another shot. All right, well, congratulations, Tony Donovan. I will be reaching out to you later this morning to make sure we have the information that we need to get you your Amazon e-gift card. Let's get back here to our screens. All right, so before we wrap up today's presentation, we do want to open it up to question and answer. If you have a question that you'd like to ask about today's topic or the SMP program, please go ahead and raise your hand. As you can see on the screen, you should have a little hand button and you can raise it. We'll unmute your line and you can ask your question, or you could feel free to type that into the chat. All right, well, I'm not seeing any hands raised. So this will conclude our presentation today on home health and hospice fraud. Thanks again to Keith and Danielle for presenting today. Please take care, and we hope you will join us again for our next webinar Wednesdays with SMP. Thanks again, and everyone take care.